afternoon and early evening is their biggest challenge for food choices. In the very beginning, remember, you're establishing changes. And in the very beginning, you're probably not used to having protein on every meal. You're also probably not used to looking at labels. This is a handout. It is a food journal worksheet that you can get in the education room. I do highly recommend that you initially, in the beginning, to do the worksheet much more frequently. It won't be long before you almost have things memorized, because we don't even eat that many different kinds of food. So with the worksheet, you would list what food that you've eaten, the time, estimate your carb, protein, and fat grams, and you can use the little resource book, you can use the labels, or you can use the handout with regard to estimating the protein. But this little exercise is extremely helpful. Education is one of the things that really changes us, and changes are what are being accomplished here, changes in your lifestyle. So this is something that's going to certainly increase your chances of being successful, short and long term. Now I want to talk a little bit about the appetite suppressant medications. These appetite suppressants have been around for literally decades. Here at Medallion, there are two different ones being offered. They're very popular. The Phentermine, the other one is called Phendimetrazine. These are both very, very comparable medications. They have the same mechanism of action, the same side effect profile. You might ask yourself, which one is the better one? Which one is stronger? I've been asked that many times. There are comparable dosing. Of the people that have tried both, because there is no research that says that one is more effective, but from comments made along the way, people that have tried both, it is a matter of individual preference, individual difference. Some people that have tried both like one better, some people that have tried both like the other better, and some people that have tried both can't tell the difference. So generally, if you don't have a preference, I usually recommend that you would start with Phentermine, because over half my patients are taking Phentermine and doing quite well. And certainly at any time along the way, you can ask to try the other one. You can either go back and forth also if you want to kind of get a feel for what your own individual preferences are. And not just for which medication, but also some timing and dosing strategies. All of these can be individualized. Now, with regard to the Phentermine, it does come in a little tablet that is very easily broken in two. I do have many patients that take 1/2 of a tablet for the entire day and do quite well. Also, I do recommend starting at the lower doses, because there is a great chance that you're going to do quite well. Also, by starting at the lower doses, you are likely to avoid possibly some of the side effects, the most common being dry mouth and problem sleeping, which tend to be more so, by the way, in the first few nights. So I do recommend that you would have your protein breakfast first. The empty stomach means that you would take your dose approximately 2 hours after eating, so allow 2 hours for the stomach to empty, and take your morning dose. Start with 1/2, and then wait an hour before you would eat again. And if you wanted to bump the dose a bit later, taking it even an hour before lunch, that would be fine too. Probably more likely to be able to take only 1 dose a day. Another afternoon dose is an option. The afternoon dose typically would be a smaller dose, possibly 1/2 of a tablet, and no later than 6 hours before sleep. Remember, taking the 3-part non-habit forming sleep aid will be definitely an advantage here in being able to take that afternoon dose covering for the more challenging late afternoon, evening. Now the dosing, remember, can be taken not at all, intermittently, or every day. So lots of options. In reality, most patients are going to have a significant supply of the medications left over. And rather than tell yourself, well, I have a lot of leftover medications, I think I will not return for my 2-week follow-up visit. I'll schedule it down the road. I really discourage that. What I do recommend is to take all of the leftover medications, put them in a separate container, and use them for down the road. In the beginning, remember, you're establishing a pattern in your life. In the beginning, you're much more likely to be successful if you keep your 2-week visits in the beginning, and then after you start to get a bit of a sense of routine, that you're losing at least 1 pound a week, you're feeling good about the situation, it's starting to feel very good, then at that point, you can start using up those leftover medications. There's an extremely long expiration date, so they're even good for over a year after they are dispensed from the office. So at that point, you can start using up the leftover medications, start stretching out your visits, maybe coming every 4 weeks, etc. I do recommend that you use the clinic as a source of support. There's a $20 fee for non-medication visits. It is recommended that you would visit the clinic at least every 4 to 6 weeks for even a year after the weight is off. The other medication that we have at Medallion is called Phendimetrazine. The Phendimetrazine comes in a 12-hour sustained release capsule that is a higher dose, and it also comes in a 1/3 dose, short-acting 4 to 6 hour tablet. The 12-hour sustained release capsule, in the first few days, if you do choose to use the Phendimetrazine, I would recommend that the capsule be taken actually right when you wake up, because you may have some problems sleeping, which are much more common in the first few nights. So see how things are going, and then after a while, instead of first thing in the morning, I suggest that the capsule be taken 2 hours after breakfast, and no later than 12 hours before you go to sleep. The extra little dose, the 35 milligram tablet, that can be taken no later than 6 hours before sleep. If you have leftover, you can take 2 of them in the afternoon. And some people have actually come to the conclusion that they prefer to not even use the capsules. So for these individuals, I dispense the same overall dose, but all in the form of the little yellow tablets. So in this case, maybe 0, 1, or 2 little yellow tablets would be taken 2 hours after breakfast instead of the capsule. And then another 0, 1, or 2 tablets of the Phendimetrazine, 35 milligrams, taken no later than 6 hours before sleep. The next thing I want to talk about is maintenance. I am asked many different times, what is going to happen when I stop taking these appetite suppressants? Am I going to regain all the weight? The answer is complicated, and it has to do with really how successful a person has been at integrating these changes into the habit structure. Remember, habit formation takes a full year. Keep the protein on board. Get those starches and sweets dialed out of your life as much as possible. Integrate all these changes into the lifestyle. If you've been more successful at making habits in your life, then the appetite suppressants will most likely be less of a tool that you can use long term. The American Society of Bariatric Physicians has designated, remember, 10% weight loss as success, and they do have guidelines for the use of these prescription appetite suppressants. And it is within the guidelines to use the prescription appetite suppressants long term, for even years. So they can be used intermittently or at the full dose for years if that is felt to be helpful or necessary to maintain your weight loss. And remember, once you have established yourself as a patient here at Medallion, you are always considered an ongoing patient. So there's never a re-startup fee. Even if it's been years since you visited the clinic, you're always welcome to come into the clinic and restart, kind of get back into it, not paying re-startup fees, but just kind of building up some extra support, getting back into some healthy habit formation. Thank you very much. Bye-bye.